Hello students, I'm Dr. Himanshu Arora from Department of Anthropology, University of Delhi. Today I'm going to speak on the module Health Management in Anthropology from the paper Applied Anthropology. First of all, let's discuss the learning objectives of the module. These are to provide an introduction to the field of health management in anthropology, to explain the basic concept of health and factors that influence the health, and to understand the role of anthropology in public health management. Let's start with a brief introduction of health. World Health Organization states that a good health is a state of complete physical, social, and mental well being and not merely the absence of disease or infirmity. Health is a resource for everyday life, not the object of living, and is a positive concept emphasizing social and personal resources as well as physical capabilities. Health is a fundamental human right recognized in the Universal Declaration of Human Rights 1948. It is also an essential component of development, vital to nations' economic growth and internal stability. Along with the traditional and unequivocal arguments on social justice and the importance of health, it is now accepted that better health outcomes play a crucial role in reducing poverty. There is also increased understanding of how health fits into a wider cross sectoral, cross border, and globalized framework. Four key values guide efforts to address health issues are recognition of the universal right to health, continued application of health ethics to policy, research, and service provision, implementation of equity oriented policies and strategies that emphasize solidarity, and incorporation of a gender perspective into health policies. Health ethics involves a process of systematic and continuous reflection on the norms and values which should guide decisions about health care at the personal, institutional, or societal level, and by which the outcomes of such decision may be judged. On the other hand, moral reasoning involves pursuing rules, principles, and theories. Moral rules states that actions of a certain kind ought to be done because they are right or wrong. These rules are justified by basic and independent principles such as justice, respect for persons, beneficence, and parsimony. These principles reflect comprehensive ethical theories such as utilitarianism, right, in which the rightness of a choice depends on whether it maximizes the good, and deontology, in which actions are judged according to their adherence to fundamental duties, compared to medical ethics, which focuses on individuals' health. Health ethics also encompasses the full range of health determinants and their interconnections, viewed from a societal or systems perspective. A health determinant is a force or element that affects health either positively or negatively. Health is determined by both intrinsic forces such as genetics, behavior, culture, habits, and lifestyles, and extrinsic forces such as preventative, curative, and promotional aspects of the health sector, as well as elements outside the health sectors, including economic factors such as trade, social factors such as poverty, environmental factors such as climate change, technological factors such as information technology. Global health refers to widespread health impacts that affect large numbers of people across boundaries of geography, time, and culture. It includes the impact on the global ecosystem and other health determinants such as poverty and genetics. Global health implies a context that includes the whole world and produces its own institutional complexities. Recently, a clear recognition has emerged that the solution to many health problems lies in addressing their root causes, that is, health determinants, many of which are outside the direct control of the health sector. This means it is necessary to integrate effective health dimensions into other sectors such as agriculture, transport, and housing in what are called cross sectoral policies. For example, poor housing, inadequate and unsafe water, and pollution all expose people to health risks. This requires new levels of cooperation between health and various other development sectors. However, cross ministry and multi donor coordination is particularly difficult in countries that are poor and when ministries lack resources to fulfill their mandate. Now, let's discuss about public health. Public health refers to all organized measures, whether public or private, to prevent disease, promote health, and prolong life among the population as a whole. Its activities aim to provide conditions in which people can be healthy and focus on entire populations, not on individual patients or diseases. Thus, public health is concerned with the total system and not only the eradication of a particular disease. The three main public health functions are: firstly, to assess the assessment and monitoring of the health of communities and populations at risk, to identify health problems and priority. Secondly, the formulation of public policies designed to solve identified local and national health problems and priorities. And lastly, thirdly, to assure that all the populations have access to appropriate and cost-effective care, including health promotion and disease prevention services. Public health professionals monitor and diagnose the health concerns of entire communities and promote healthy practices and behaviors to ensure that the population stay healthy. One way to illustrate the breadth of public health is to look at some of the notable public health campaigns like vaccination and control of infectious diseases, motor vehicle safety, safer workplaces, safer and healthier foods, safe drinking water, healthier mothers and babies and access to family planning, decline in deaths from coronary heart disease and stroke, recognition of tobacco use as a health hazard. The focus on a public health intervention is to prevent and manage diseases, injuries, and other health conditions through surveillance of cases and the promotion of healthy behaviors, communities, and environment. Many diseases are preventable through simple non-medical methods. For example, research has been shown that the simple act of hand washing with soap can prevent many contagious diseases. In other cases, treating a disease or controlling a pathogen can be vital to prevent its spread to others, such as during an outbreak of infectious diseases or contamination of food or water supplies. Public health communication programs, vaccination programs, and distribution of condoms are examples of common public health measures. Measures such as these have contributed greatly to the health of populations and increases in life expectancy. Public health plays an important role in disease prevention efforts in both the developing world and in developed countries through local health systems and non-governmental organizations. For instance, the World Health Organization is the international agency that coordinates and acts on global public health issues. Most countries have their own government public health agencies, sometimes known as Ministry of Health, to respond to domestic health issues. For example, in the United States, the front line of public health initiatives are state and local health departments. The United States Public Health Service, led by the Surgeon General of the United States, and the Centers for Disease Control and Prevention, headquartered in Atlanta, are involved with several international health activities in addition to their national duties. In Canada, the Public Health Agency of Canada is the national agency responsible for public health, emergency preparedness and response, and infectious and chronic disease control and prevention. The public health system in India is managed by the Ministry of Health and Family Welfare of the Government of India with state-owned healthcare facilities. After briefing on health, now it's time to discuss the different concepts related to health. Health is often taken for granted and its value is not fully understood until it is lost. During the past few decades, there has been a reawakening that health of workers is a fundamental human right, and therefore the attainment of the highest level of health is most common so important social goal. Health has been viewed by different people from different angles, giving rise to different concepts. The first concept we will talk about is biomedical concept. In general, health has been traditionally defined as absence of disease and disease as a deviation from the biochemical norm. However, this model was found inadequate to solve some of the major health problems of mankind, such as the population problems, problems of malnutrition, mental illness, chronic diseases, drug abuse, and accidents. The second concept is ecological concept. In this concept, the ecologist viewed health as a harmonious equilibrium between man and his environment, and disease as a maladjustment of the human organism to environment. The third concept includes the biosocial and biocultural concept. In this concept, the development in social sciences revealed that disease is both a biological and social phenomenon. These are not only biological factors but also social, cultural, and psychological factors, which must be given equal weightage in defining the health and illness. The fourth and last concept is holistic concept, which is synthesis of all of the above concepts. According to this concept, health is a multi-dimensional process involving the well-being of the whole person in the context of his environment. This concept corresponds to the ancient view that health implies a sound mind in a sound body, in a sound family, in sound environment. WHO, in its definition of health, considered the three specific dimensions of health, that are physical, mental, and social. These three aspects of health are interdependent and influence each other, determining the status of health of an individual at a particular moment. Let's pour some light on these dimensions of health. Physical health is a state in which every cell and every organ is functioning at optimum capacity and in perfect harmony with the rest of the body. This can be achieved by proper nutrition, balanced diet, and regular exercise. On the other hand, mental health is a state in which the individual feels a sense of perfect well-being and of mastery over his environment. A mentally healthy person is free from internal conflicts, well adjusted with others, and has good self-control. He faces problems and tries to solve them intelligently. But the social health is a state in which the individual's capacities for participation in the social system are optimal. It focuses on well-being of the whole person in the context of his social network. Apart from these, positive health is also important when a person who enjoys health at the three planes, that is physical, mental, and social well-being, is said to be in a state of positive health. There are innumerable factors that affect the health of an individual, and they may be classified in various factors including genetic, environmental, ways of living, socio-economic status, health services. Let's discuss about these factors individually. First one is genetic, which we can say that the physical and mental traits of every human being are to some extent determined by the nature of the genes at the moment of conception. The genetic makeup is unique and cannot be altered after conception. A number of diseases are now known to be genetic in origin, such as hemophilia, mental retardedness, and diabetes. The state of health, therefore, depends partly on the genetic constitution of man. Secondly, environment, which has a direct effect on the physical, mental, and social well-being of those living in it. Most of the diseases like typhoid, cholera, worm infestation, etc., are due to environmental deficiencies. There is also increasing evidence that chronic diseases, accidental injuries, mental illness are major outcome of man's maladjustment to his exposure to environmental hazards. Also, health is related closely to lifestyle, which includes ways of living, personal hygiene, alimentary habits, and behavior. The major health problems are related significantly with a change in lifestyle, such as malnutrition, obesity, heart disease, accidents, drugs, and alcohol abuse, suicides, and homicides. The achievement of optimum health demands adoption of healthy ways of living. Also, the health of an individual is closely related to his economic status and his social organization, as the poverty sometimes leads to sickness by depriving man of his needs of adequate nutrition and shelter and by exposing him to the hazards of poor sanitary conditions. Poverty predisposes to diseases due to malnutrition. It also predisposes to crime, violence, drug abuse, depression, and alcoholism. It can also contribute to illness, as can be seen by the high incidences of heart disease, hypertension, obesity, diabetes, and mental illness in the upper socio-economic groups. Other factor that influences the health is health services. Both the quality and quantity of health services affect the health of an individual. For instance, immunization program influencing the incidence of particular diseases like hepatitis B, polio, etc., and provision of safe water supply can solve the problem of waterborne diseases. Now, let's focus on the role of anthropology in public health. Anthropology is a cross-cultural study of medical systems and the study of bioecological and socio-cultural factors that influence the incidence of health and disease now and throughout human history. The areas where the medical or physical anthropologists do research are human evolution, anatomy, pediatrics, epidemiology, mental health, drug abuse, definition of health and diseases, training of medical personnel, medical bureaucracies, hospital organization and operations, the doctor-patient relationship and process of bringing scientific medicine to users of traditional medicine. Also, the physical and medical anthropology can be studied as a bipolar processes whose one pole is biological, in which one studies human growth and development, role of diseases in human evolution, and study of diseases of ancient men. The second is socio-cultural pole, where one studies traditional medical systems, illness behavior, doctor-patient relationship, introduction of Western medicine to traditional societies, and in between this, there is epidemiology and cultural ecology. So, medical anthropology encompasses the study of medical phenomena as they are influenced by social and cultural factors, and social and cultural phenomenon as they are influenced by these medical aspects. Another definition states that medical anthropology is concerned with the biocultural understanding of man and his works in relation to health and medicine. Anthropology also studies the relationship between human evolution and diseases in the past, the biological and cultural determinants of disease, health, and health care, the basis and effectiveness of traditional healthcare systems, and suggests way to integrate modern medicine into traditional societies. Hence, medical anthropology does not study the relationship of individual person to disease, but studies the relationship between biological and cultural characteristics of a group, that is ethnic or racial, and its resistance of susceptibility to various diseases in view of different genetic constitution. In studies the traditional medical systems but not the modern systems of medicine. It helps to understand the disease prevalence and susceptibility to the genetic makeup of a man belonging to a particular race or ethnicity, impact of disease on human evolution, and the impact of these inherent ethnic and racial differences on the functioning and acceptability of health care. It is important to know the role of anthropology in health system development. Role of anthropology in health system development. Public health as seen from the eyes of comprehensive primary health care mentioned in Alma Ata Declaration covers many aspects which I will discuss subsequently that can be analyzed from social and anthropological perspective. It sees health as a process in human development and states that it cannot be achieved in isolation without associated socio-economic development. It strongly affirms that health, which is the complete state of physical, social, and mental well being, and not merely the absence of disease and infirmity, is the fundamental human right, and to achieve the highest level of health should be a worldwide social goal. For health, it lays emphasis on all the aspects of healthcare, that is, preventive, promotive, curative, and rehabilitative. Its shape is determined by social goals like quality of life and maximum health benefits to the greatest number of people, and advises to attain these goals by social means like community participation. It lays emphasis on essential health care, which is accessible, affordable, and acceptable by the people and their full participation. This health care has to be scientifically sound and socially acceptable. It requires coordinated efforts from all other related sectors. It is based on the economic, socio-cultural, and political conditions of a country, and it promotes equity. While taking about the role of anthropology in health management, it is important to know that health and management is a problem being experienced in probably the majority of countries across the world, is that the public health function is still not receiving firm enough support at political level. Even where that commitment appears to exist, and there are signs of a newfound commitment to public health, under resourcing of the public health infrastructure and capacity prevents public health from playing the strong role advocated for it. As a consequence, the levels of health achieved by populations are seriously below what could be obtained if application of current knowledge in public health was pursued more vigorously through a stronger public health approach and infrastructure. It is clear that public health practice in both developed and developing countries needs sustained political support and substantial development. In particular, there is a dearth of appropriate public health training and dissemination of public health experience and practice. To address these issues, a workshop jointly organized by the World Health Organization, Non-Communicable Diseases and Mental Health Cluster, and the University of Durham, England, was held at the University of Durham. The issues considered in this workshop are exploring the concept of public health management, the importance of public health management for all countries, the implications of public health management for chronic disease management, public health management at a national policy level and at local operational level, to describe the skills and competencies required of managers and practitioners working in public health management, implications for education and training. Now, why this health management is important, why we should study it. Neither managers nor public health professionals appear to be doing a good job in improving the public's health if judged by the evidence from many countries, both developed and less developed. This shows the widening health gap between the sections of society, in particular between those who are affluent and those who are poor. The gap is growing faster in some countries than others, but nowhere is it closing despite the efforts of the government and their renewed commitment to the public health function. Moreover, concerns about food safety and the environment have contributed to a widespread sense that public health issues have not been given sufficiently high priority by governments. Even within healthcare system, public health practitioners seem unable to make things happen to improve the health of their populations. In contrast, healthcare managers can make things happen even if they do not always know why they are doing it beyond the need to attend the latest fad or fashion favored by their political masters and mistress. This may include the restructuring whole healthcare systems, building another hospital regardless of whether or not it is needed, or developing some other healthcare facility to improve access or reduce waiting lists. So, what are the distinguishing features of public health management? It is multi-sectoral and professional at the same time. It combines knowledge with action. It has epidemiology at its core. It is influential across all health determinants. It involves public health reporting, leading to health strategy development. It communicates with politicians, professionals, and the public. It is influential organizationally and financially. It lies at the heart of the civic society. Now, roles. So, what could be the possible role public health management plays in health? It is important in advocacy and management roles. It possesses knowledge and action simultaneously. It has managerial capacity and infrastructure. It is a kind of networking to create partnerships across organizations and disciplines. It is a broad involvement of people and skills. It has infrastructure and curricula for education. It is an evidence-based policy and practice. It is an outcome-based focus. It is a national agenda for health and health services research. In the end, let's summarize what we have discussed as of now. The Constitution of WHO states that good health is a state of complete physical, social, and mental well-being, and not merely the absence of disease or infirmity. There is also increased understanding of how health fits into a wider cross-sectoral, cross-border, and globalized framework. Four key values guide efforts to address health issues. A health determinant is a force or element that affects health, either positively or negatively. Global health refers to widespread health impacts that affect large numbers of people across boundaries of geography, time, and culture. Public health refers to all the organized measures, whether public or private, to prevent disease, promote health, and prolonged life among the population as a whole. Public health professionals monitor and diagnose the health concerns of entire communities and promote healthy practices and behaviors to ensure that the population stay healthy. The focus of a public health intervention is to prevent and manage diseases, injuries, and other health conditions through surveillance of cases and the promotion of healthy behaviors, communities, and environments. Health of workers is often taken for granted and its value is not fully understood until it is lost. Health of workers has been traditionally defined as absence of disease and disease as deviation from the biochemical norm. Development in social sciences revealed that disease is both a biological and social phenomenon. Physical health is a state in which every cell and every organ is functioning at optimum capacity and in perfect harmony with the rest of the body. Mental health is a state in which the individual feels a sense of perfect well-being and of mastery over his environment. Social health is a state in which the individual's capacity for participation in the social systems are optimal. The physical and mental traits of every human being are to some extent determined by the nature of the genes at the moment of conception. Environment has a direct effect on the physical, mental, and social well-being of those living in it. Health is related closely to lifestyle, which includes way of living, personal hygiene, alimentary habits, and behavior. A problem being experienced in probably the majority of countries across the world is that public health function is still not receiving firm enough support at political level. Role of anthropology in health system development, public health as seen from the eyes of comprehensive primary health care mentioned in Alma Ata Declaration. It is clear that public health practice in both developed and developing countries needs sustained political support and sustainable development. Neither managers nor public health professionals appear to be doing a good job in improving the public health if judged by the evidence from many countries, both developed and less developed. Thank you.